Hello and welcome to Beyond the Scars. I'm Sophia, and I am basically journaling and giving my perspective on having a double mastectomy with reconstruction and what's called a DIEP flap. Um, I just basically wanted to make this video to kind of give an update to what's been going on since the procedure. Um, so in another video, I kind of talked about, you know, the complications I was having afterwards, in which it was in regards to my breathing. Um, it's really hard for me to explain, what that felt like. And I mean, no disrespect or anything like that, but I kept referencing or saying to my doctors that I felt, just extremely heavy. I'm not, um, I'm not a huge person as far as like in stature. Okay. I'm probably, like 170 pounds, soaking wet. I mean, and I'm 5'7". So not a super huge person. I mean, most people, I guess, consider me as being kind of thin. Anyway, um, my breathing was like an issue, and I noticed it maybe like 2 or 3 days after, waking up from my surgery. It's like any little task that I would do, I just felt overexerted. Just, things as small as going from my bed to the restroom, I would be literally out of breath. If I wanted to go and get myself a cup of water, I am out of breath. After I took, 5 or 10 steps, I'm like wheezing, breathing so hard to where I have to sit down and gather myself. And, I wear my watch like a lot of the times and I'm looking like Jesus, my heart rate is like really increased and it was just hard and it started getting really unbearable. But I think that what really did it for me or kind of made me feel like, hey, it's more than um, what I'm thinking initially, that it's not all in my head. You know, um, One of my breasts, it's still fairly firm in comparison to, the other, which is a little more, I don't want to use the word supple, but it's a little softer. Okay. So anyway, this breast is a little softer than this. Okay. And this breast actually started showing like some discoloration, meaning that it was turning like a greenish blue, like bruising was going on underneath there. And I remember going to my doctor, and kind of asking about it. And, again, y'all, I'm breathing hard. I mean, I felt like I'm carrying around like 600 pounds of weight on my little frame, and I'm just barely making it. So going to the doctor. And at first I wasn't seeing the doctor himself because either he would be in surgery or, it was something going on. So his nurses were, supposed to be tending to his patient. So I'm telling the nurse, hey, this doesn't seem right, all of these things. And, I kind of felt um, like it was dismissive, like maybe it's all in your head and it's just going to take time. And it's because you were under anesthesia for so long, because in total, I think my surgery was maybe like roughly 9 hours that I was under anesthesia. And, I was told that, sometimes when you're underneath anesthesia that long, because your lungs, they have this tube down your throat in order to assist with you breathing. Yeah, your lungs, they're telling me my lungs, just kind of became dependent upon that. And it's going to take a little time in order for them to readjust, in which it seemed a little weird to me at the time, but I'm like, hey, you're supposed to be the medical professions. I mean, I guess so. I gave it time, so after about a week or so, I'm like, hey, this isn't getting any better, and they're like, hey, just, blow into the, I don't know what it's called. It's some sort of device you blow into it in order to help strengthen your lungs or whatever. So I'm doing that multiple times throughout the day. I'm getting up, I'm walking or trying to walk, um, every 2 hours. I was supposed to do like every hour, but I was doing like every 2 hours because, like I said, I was just that tired. So I'm doing that, and trying to, not consume so much salt, doing all the things that they're recommending that I do in order to, just start the healing process off well, or on a good foot rather. So, 1 week went by, 2 weeks went by, and I'm still having the same symptoms. And then I ended up going in because I'm like, hey, my breathing is, it's getting short and I don't feel like I'm getting any better. And then I'm like, hey, the other day I have stairs in my house, and actually my bedroom is upstairs. So I can't remember if I was going up or down the stairs, but I remember having this really sharp sensation like in the bottom of one of my feet. And I'm like, geez, what is that? And it kind of traveled from like my foot, like up mid calf or whatever. And then it just kind of like all of a sudden went away. So, and I'm like, that's really weird. So I ended up going to see the actual surgeon who did the removal, because there were like multiple surgeons there, one to do the removal, the total mastectomy, and then the other to do the reconstructive portion. So I went to see the person that did the removal, and after talking to her, we kind of both came to the same conclusion that, hey, we need to have some extra tests done. So that doctor, she ended up ordering like some additional labs and a angiogram. So I want to say that was like on a Wednesday, and then by that Friday, I went and well, that Wednesday I had my labs and everything done same day. That Friday I went and did the angiogram. So, I'm waiting, and they're like, hey, it's going to take a couple of days in order for that to come back, and, so on and so forth. And which, that's reasonable. I mean, I don't expect like an overnight, return, because, hey, who am I? They have thousands of patients that they're tending to. It's fine. So anyway, fast forward to that Monday, my surgeon who did my removal, she calls me, and it's like 7:30 in the morning, and she's like, Miss Carter, what are you doing? And I'm like, I'm getting ready to get out of bed, and, kind of get my day started, brush my teeth and, all the things. And she's like, well, hey, after you finish doing all that, get dressed and take yourself to the emergency room. And I'm like, why am I going to the emergency room? And I thought it to be a little odd that she personally called me anyway, instead of like, one of her nurses or her assistant or whatever. And then I'm thinking to myself, like, I don't even think your office is open or your practice is open right now. And it's like I said, 7:30. And she's like, no, you need to go to the emergency room right now. And I'm like, well, what is going on? What did you find out that was on the angiogram? Turns out I have multiple blood clots in my lungs and possibly in my legs. So the shortness of breath that I've been experiencing for weeks now is a direct result of having those blood clots. Okay. So I go to the emergency room, and at this time I'm distraught, I'm not even gonna sit here and pretend like I wasn't tore up and my feelings are hurt, because in my mind I'm thinking, hey, you're getting better and you're healing, and there shouldn't be any more hiccups, and some doctors are saying, hey, no, you're fine, and it just looks like that, and that's just what it's supposed to be, and so on and so forth. But then I just really started thinking, hey, well, what if I didn't push or be more persistent about, them taking an extra look and me not listening to my body? What could have happened, right? So, of course, inside my thoughts while I'm there in the emergency room waiting to be seen, y'all, I'm bawling, I'm crying. I'm just like, what is happening? Why is I don't even understand. I don't have the words to express, how I felt, you know. So after all that, and the hospital, it's full. I mean, there are like people everywhere. And by the time I got there, it may have been a little after 8. The emergency room is literally like 10 to 12 minutes from my house. So I just went to the nearest one, in which thankfully it's in network with the surgeon who did my removal, so she can see everything that's happening. So, I'm there, and it's super crowded. There's nowhere for me to go. They literally did not have a room for me to go to in order to start treatment. Guys, I started my treatment literally in the hallway on a bed, pushed up against a wall, attached to an IV, doing the blood thinner, the heparin or whatever, it just looking a total mess. I felt so displaced and just uncomfortable, and anything that you can think of, I felt it. Okay. So I'm laying there getting this treatment. Now, mind you, it's like I just cannot stop crying. I mean, I'm bawling, you know, and I know that medical professions, they're trained not to, you know, I guess become emotional with patients and things like that or whatever. And I get it, because if they were like that day in, day out, they would be an emotional wreck and probably couldn't do their job. So I understand it from that capacity. But, you know, um, what I will say is that I think that there's so much stuff that's going on in the background that we don't see inside of these hospitals. And, I really did just feel like cattle being shuffled around for whatever reason. I'm feeling all these things, and I'm not going to say that what I felt was right, but did it feel like it was humane sometimes? No, it did not. Um yeah, so you know, it wasn't until I remember laying there and I'm just crying and I'm trying to calm myself down, and I'm like, you know what? I'm giving myself this pep talk like, hey, it's gonna be okay. You know, this is happening for a reason. You know, um, all the things. I'm trying to stay optimistic, but y'all, I'm like literally like crushing on the inside. So I remember, you know, just sitting there crying and kind of, in my own pity party, so to speak. And along comes this doctor, or I didn't know who he was at the time. But I remember just laying there, receiving a treatment or whatever. And he walked up to me and he says, I think it's you that I'm supposed to be talking to. He says, are you Sophia? And I said, yeah, I am. And he says, oh, I'm sorry it took me so long to come and see you. He said, but I went through like your whole profile and I see everything that you have been through. Everything. He's going back and telling me about, my initial diagnosis when I had a lumpectomy back in 2018. He's looking at, I've had thyroid surgery and thyroid cancer, and I had half my thyroid removed. He looked at my whole profile. He's telling me this. And he says, and then I'm looking at you now, and he's like, you know, sister, you've been through a lot, and you are really hurting right now. And I'm like, I am, but I'm trying so hard to hold it together, but I don't know if I can. Okay. So, anyway, me not knowing at the moment that, hey, or feeling like, I don't know if I can keep this together. I don't know how much more of this I can take, because I just feel like God is just breaking me. He is snapping me in two, and I'm like, this just cannot be happening, you know. So anyway, he tells me that he's looked at my whole profile, and he's like, um, he says, Did they tell you, that because you had this surgery, had a lumpectomy before, because I've done chemo, I've done radiation, and then now I'm doing this. He said, you are or were very highly susceptible to developing blood clots just based on your history. And I'm like, no, nobody told me that. And if that's true from a medical standpoint, why is this something that you guys were not looking at or looking for or being watchful for? Especially if I'm coming to you and I'm telling you, hey, I'm having a hard time breathing. Okay. Anybody that knows me prior to this particular surgery, I'm a gym rat. Okay. I go and I run, I lift, my spare time is spent at the gym. That's just what I do. That's what brings me peace. Okay. That's where I go to think and to sort things out. It's at the gym. So for me to go from being able to have this level of endurance, okay, and to be able to run for miles and it not bother me, to go all the way to a completely different side of the spectrum to where I'm barely breathing, which is minimum movement, is strange to me. So I knew something was going on with my body. Okay. Um, yeah. So in knowing that, and I felt like he was the only person throughout this situation that really understood, and he kind of brought light to the situation and how he explained things to me and made it clear as to, hey, no, that this, he said, I see this happen often, especially if you've had radiation, in which I've done that. Okay.
So, with all that being said, I hope that this video, it helps someone. If you know anybody that's dealing with breast cancer and they're considering, removal or reconstruction or, anything relating to that matter, if it's not you and you know someone, all that I ask is that you pass this information along, because you never know how it may, impact someone else. I feel like that's my purpose, to share this journey, um, share the things that I'm experiencing, because at the end of the day, I don't see, and I'm not saying this to be funny. I don't see many people that look like me, all right, that are, sharing their experiences in detail and, just telling some very intricate details, I'm sorry, about that, and the emotions that are attached to this. At some point in this series, I'll touch base with how this has affected just my life in other capacities. I have a husband, and this has been hard on him too. And it takes away from a lot of different facets in your life, and contrary to what most believe, it's not just you. It affects everybody that is around you, especially the people that you care about or the people that say they love you. Okay. So please, like, share, comment, um, subscribe if you want to continue on the journey. And I hope that, you guys are having a beautifully blessed, wonderful, peaceful day. And I will talk with you guys soon. Bye.